afternoon, everybody. I'm Stephanie McLeod. I'm the director of the Ohio Department of Health. Thanks for joining us today on short notice. As you know, we've been very, very busy with Vax-A-Million and wanted to have this, not let this delay and have this conversation as well. I have with me today, of course, the ODH Chief Medical Officer, Dr. Bruce Vanderhoff. And also joining us today is Jeff Brown. Jeff is our data analyst extraordinaire from the Department of Administrative Services with the state. And we just want to cover a couple, actually just one kind of issue today, just to make sure everybody's aware. We are no longer going to update and are ending our public health advisory system effective today. You might recognize it more as the color-coded advisory system. It was released back in July 2nd of 2020, and it was a warning system. We've talked about this in the past. It was to warn communities of increasing concerns related to COVID-19, and it did this by providing counties with data related to the spread of COVID and assigning risk alert levels and colors. And this allowed them to respond accordingly as they saw fit. The system was built as the pandemic, of course, was intensifying, and we needed to keep close track of certain information. This helped limit the spread, saved lives, and ensured our hospitals were able to accommodate all patients who needed care. It had several factors to it, as you may recall, different elements that were included that helped us track that information. In December, you may also recall that Governor DeWine began moving away from the use of the public health advisory system, and we started looking more at incident rates and ICU utilization. The public health advisory system, as you may have heard him or me say in the past, was more of a storm predictor. By the time we got to December, I think we all remember the storm was here. We didn't need any more predictions. And now we're at a point where we're looking at other things moving forward. We're looking at vaccination numbers. We're looking at those total average numbers. We're watching the cases. The other significant data point is what matters, and that's specifically that we are edging toward having half of all Ohioans vaccinated against COVID-19. As of yesterday afternoon, more than 5.2 million Ohioans have lowered their risk of contracting COVID-19 by getting at least one dose of the vaccine, and we are obviously very excited about that. Further, case numbers are declining, and our statewide per capita rate as of today—
Recording in progress.
Our statewide per capita rate as of today was 82.3. We're in a very different point in this pandemic, and the need for this kind of urgency has kind of passed. So we're looking to move on. Hopefully what we'll see as we head toward, now that we're getting a little more comfortable as we move toward the summer, that we're more comfortable that the light in the tunnel is not, in fact, a train heading toward us, that we may look to more things next week. We're excited to have the orders, a lot of the orders regarding masking and social distancing expire. And so this is something you can expect moving forward as we start hopefully phasing off of some of these older metrics and looking toward the new things that health will face. Dr. Vanderhoff, I'll turn it over to you.
Well, thanks, Director. I think the Director actually covered the information very, very well. I'll just add a few quick comments. Early in the pandemic, we were confronting a contagious disease that is able to cause very serious illness and death. We all watched through much of the pandemic, those numbers, including hospitalizations and deaths, really hit some very worrisome levels. And during all of that, the major problem was that we lacked any significant protective immunity. And this, of course, posed a real threat then to our actual healthcare delivery system. But as the Director indicated, the picture now is really very different, and it's begun to change because of vaccines. Vaccination has provided us with access to the kind of protective immunity that we lacked, and it's been steadily reducing our vulnerability, as well as the absolute number of Ohioans who are directly impacted by COVID-19. As she noted, with nearly half of Ohioans well protected now from COVID-19, our data tells us something different than it did when we were all at risk. Vaccination and the vaccination rate is truly an important indicator. Also, as she noted, the governor has been pointing us for quite some time also to looking at the number of cases, which is another critical measure, the number of new cases reported over the 2 weeks, 2-week period per 100,000 residents. And also she noted, that number is steadily improving, steadily moving down now below 100 cases per 100,000, heading towards 50. So we're at a different point in the pandemic, and a different point than we were when this advisory system was released. Now I'm going to turn it to Jeff so that he can tell us a little bit more about the early warning system and why it's really no longer as useful as it was last year. Jeff?
Yeah, thanks, Dr. Vanderhoff. And building on what the director and Dr. Vanderhoff said, we are at a different point in the pandemic at this point. There is a heavy focus on vaccinations and, specifically with the alert system, the increasing number of Ohioans who have been vaccinated really reduces the numbers that are available within the alert system. And what that means is the alert system was built, again, as Director McLeod said, as an early warning system. And a lot of the focus within it is sustained increase in numbers in certain metrics, right, to show that upward trend that helps identify that the storm is coming. But over time, as we've got more folks who have been protected through vaccines, the numbers within those sustained increases are just not as meaningful as they once were, where you see maybe cases ticking up by a case or two a day, and that may happen over a sustained period of time, which triggers some of the alerts. But at the aggregate level for that community, given the actual volume within that increase, it's not relevant to use within the alert system anymore as it was designed. Additionally, we've been pretty consistent. We've been extremely consistent with the use of the alert system since it was rolled out, and we didn't want to be changing the rules on people consistently. It's been the same programmatic system that's determined the whether different alerts got met, and overall the color score for the county have remained consistent really since it was rolled out. And as Director McLeod and Dr. Vanderhoff have both mentioned, there's different measures that are more important. The data are different now, given the stage that we are in the pandemic, and there's different just different data that we need to be looking at as far as understanding what's happening in communities, and didn't feel like the alert system really captured that as effectively as it once did.
Thank you, Jeff. Finally, I think it's important to note that we will not hesitate to implement a different or similar system that better suits our needs at any time if we should decide that we need to do that. We've never hesitated in the past and certainly won't hesitate again. But for right now, as the prognosis, as Dr. Vanderhoff would say, is good for the state of Ohio and we continue to improve, we're hopeful there's no need for that to arise. We can now open for questions. I just would like to caveat the guests on the line that Dr. Vanderhoff has a hard stop at about 3:30. So if you have questions for Dr. Vanderhoff, please get to those early. Thank you.
Thank you, everyone. Your first question is from Joe Ingles.
Hi, I don't know if this question maybe is best suited for Jeff Brown or Director McLeod. I'm not sure who, so you guys can decide which one to take this. But some of the lawmakers over here at the State House have been saying that they think that by registering for Vax-A-Million and signing, the authority for the state to look at the shot records, that has created a publicly accessible health database in some sorts, that maybe an employer, if they have a question about whether someone's been vaccinated, they can go look at that database, and if they're registered, yes, they've been vaccinated, then they know that's legit. What about that? Is any part of this publicly accessible to people, and if so, what?
Thank you for your question. I will take that. We do not believe that this is a public record. We do not believe that the information that has been entered into the data system is available for public consumption under a public record request. Certainly, if members of the General Assembly are concerned with our legal analysis of it, the cleanest thing for them to do would be put uncodified language in the budget, which in fact protects it to their satisfaction. But we are comfortable that this information is not public record. Thank you.
Thank you. The next question is from Jake Zuckerman.
Hi, this is Jake. I wanted to ask about House Bill 248. It's had 2 hearings now, and there's talk of a third. It would block vaccination mandates from hospitals, nursing homes, businesses, schools. It would prohibit vaccine incentives, maybe including the lottery. I think that's a little unclear, but I just want, does ODH have any position on this bill that they're ready to share?
Thank you, Jake. I appreciate the question. No, I have not had a chance to analyze that with any depth yet, but thank you.
Isn't that a pretty big bill to just leave looming? I mean, that would be a pretty seismic change in vaccine policy.
Well, certainly our legislative team and the governor's legislative team are reviewing it, I'm sure, and we've been a little bit busy, but no, it's not going to loom out there forever without some analysis by any stretch. Teams are working on it. I just can't speak to it today, Jake.
Thank you. Your next question is from Jackie Borchert.
Good afternoon. I have a couple questions about the heat map. If this has been problematic for several months, why keep it going as long as you have? And why weren't the additional 3 metrics added, or the map wasn't revised at some point after July to be a better tool to reflect the reality of adding vaccinations or another data point?
Thank you, Jackie. Obviously, I was not with the department, and neither was Dr. Vanderhoff, nor do I think Jeff was working on this particular issue in July. I'm going to answer your second question first, if that's okay. And, you know, as we looked at it, there was a lot of concern. We talked about adding or changing either the metrics themselves as measurements, or the breadth or width of the measurements by keeping them on or adding some. We received a fair amount of pushback from some of the folks that we spoke with, that they were concerned about kind of a gamesmanship, that, you know, as you know, we were constantly under scrutiny, that anything we made changes to, somehow we were trying to hide something. We were trying, you know, some people thought we were trying to make it look worse. Some people thought we were trying to make it look better. And I think the idea was that it would be hard to compare. If you start changing metrics in the middle of the pandemic, it's hard to say, okay, well, based on this map, are we better or worse than we were June 3rd when it started? Well, you can't tell because the metrics are different. So we decided to stick with consistency and keep those metrics the same, so that no one felt like that we were changing or tipping the scale either way. As far as why we've kept it, you know, to make sure not doing something out of urgency, to be sure that, in fact, this doesn't really tell us what we need to know. It is something that we had out there, and just kind of making the move, looking at it, saying these numbers are so small, they don't have meaning in any way, shape, or form compared to the way they did as numbers were climbing last fall.
When you said you received pushback from folks, who are those folks?
For me personally, when I would talk to people about it, it could be any number of people from, you know, whether we were talking to not really scientists, but other physicians, or folks in kind of public policy sector, local health districts. I don't know with specificity who I talked to this particular issue about, but those are some of the people that I would normally speak with on these issues. And I just remember several of us who were having those conversations, hearing and having some concern that it would appear that we were tipping the scale one way or the other.
Okay, your next question is from Spencer Hickey.
Thank you. Just to clarify something, Director, you said the system was being eliminated, well, not eliminated, but phased out effective today, but it hasn't been published for today.
Yes, we were not going to we're not publishing it anymore.
Okay.
It doesn't, like I said, it doesn't have the meaning. We're using a system that was intended for something else. We've been reviewing it, watching it. We're not going to publish it anymore.
Can you talk about the county level metrics that will be maintained going forward? Regular dashboard?
Right. So yeah, certainly the cases per 100,000, the actual cases. Dr. Vanderhoff and Jeff, can you help me out here? What we'll have remaining on our county metrics?
Yeah. So all the case data is available. That's been there, all broken down by county, as well as additional metrics or by additional attributes are all still available for download. All the functionality that's in the dashboards that's always been there that provide the ability to drill into certain counties, look at things by age, race, etc. Similar on the vaccine side as well. You've got the ability to drill into counties and look at the vax rates over time by different age groups, sex, ethnicity, race, things like that. So that's all still, and all the vaccine percentage per county are all still out there as well. So we'll continue to track all of those numbers and include them publicly.
Your next question is from Laura Hancock.
I just want to clarify, when you say that you're going to still release cases per 100,000 for the counties, are you going to also provide us a statewide average, or is it up to us to calculate that?
Jeff, no, I think we're still doing the Thursday statewide average updates.
Correct.
Your next question is from Jim Province.
Hi, thanks for doing this afternoon. But by my count, and looking at the recent map, there were still about 17 counties that were in the red. Isn't there still a value in showing that there are still some hot spots in the state, especially in the northern part of the state? And if I recall correctly, the governor had started using this map to some extent to actually show progress in the fight against coronavirus by showing his counties were going from red to orange to yellow. Is there still value in that?
Thank you, Jim, and I'll let Dr. Vanderhoff or Jeff jump in as well. But the short answer is, I think that with such low numbers, it doesn't show a hot spot if you've met a metric because you're increasing, but your increase was from 1 case to 5 cases. The argument is with such low numbers that some of these, even though they're an increase from previous, it's 5 does not a hot spot make. And so it's kind of it's giving an import or a non-import to things that shouldn't be weighted that deeply, if that makes sense. Dr. Vanderhoff or Jeff, did you have anything to add?
Yeah, I think in a nutshell, what we're saying is that this map was very useful. It served its purpose at a different phase of the pandemic. But now what's most important, what's giving us our best indicators of where we are our rates of vaccination, our cases per 100,000. And when you listen to the governor's press conferences and other availabilities, that's consistently what's been referred to now for quite some time. So this was a good model, but it was a good model for a different phase of the pandemic.
Yeah, the last thing I'll add too, and we added functionality a couple weeks ago to allow you to use date sliders on the case dashboards that would allow you, if you want to take a look at recent cases, if you want to see all the cases, since May. So that's an enhancement we rolled out relatively recently that would allow you to see some of the areas within the state that may have higher case counts recently, but allows you to do it in a self-service manner.
Your next question is from Karina Chung.
Hello, so I believe we last used that color-coded map back in April when Franklin County went purple. If there would, for any reason, be a high exposure or spread concern, how would counties be alerted to that?
Thank you, Karina. Well, first of all, they are tracking their information just like we are. They have access to the county-specific information just as we do. We continue to share those. We're meeting with our local health districts several times a week. and then sharing information in between. But they're tracking those numbers and reviewing that information just as we are. Ours is just to look at it more from a statewide level, but they're tracking it as well. And as I mentioned before, we would not hesitate to put into place something, and maybe something different that better reflects where we are in the pandemic, but put something back in place if needed.
Your next question is from Pete Grieve.
Hi, I'm wondering what you make of the fact that I guess COVID-19 deaths and hospitalizations in Ohio have been somewhat stagnant over the past 2 months, or at least haven't fallen at the same rate as cases. And also if you could comment on how many people you think are dying in Ohio each day, just given that there's that sort of backlog and we're only reporting twice a week. I mean, do you have a sense of how many daily COVID deaths are occurring?
Thank you, Pete. And I'll turn over to Dr. Vanderhoff and Jeff as well. But the short version is the hospitalizations, when you come down with COVID, having a hospitalization doesn't normally occur right away. And even as we're reducing cases, so hospitalizations are going to lag our case numbers a little bit. And then deaths not only lag, of course, because many people have COVID for a period of time before they die, but also then the additional lag of now we're reporting out of our electronic death reporting system, EDRS, which is the kind of the gold standard of death reporting and helps clear all that up. That delays it just a little bit more. So it's going back and filling in, but I think right now what we're seeing is some of those delays. Dr. Vanderhoff?
Yeah, I think you said it very well. So these are lagging indicators that you're referring to, so you would expect them to run behind. That's number one. Number two, hospitalizations, especially as we look at concurrent hospitalizations as well as deaths today, are at a level that is dramatically lower than if we circled back to the peak of the pandemic in December, January. So clearly those metrics have improved substantially. Remember that we still have a ways to go with vaccination. And while we have very high rates of vaccination among our most vulnerable older age groups, there are still quite a few people in those brackets who could still be vaccinated. They remain vulnerable, and we're seeing disproportionately the deaths in those age brackets that continue to be recorded are happening among the unvaccinated.
Your next question is from Jim Oddie.
Hi, Jim.
Hopefully you can hear me.
Yes.
Could you look at, Director, to next week? What happens when we get to the second? Will there be where all of the previous orders just fall off, or do you have to take action to rescind those? And secondly, I want to have you speak to the state of emergency, which is a separate issue. Will that end next week as well, or at what point in the future?
Thank you, Jim. With regard to the June 2nd orders falling off, the last order, the last amended order that we put in has an expiration date on that order. It sunsets on its own on June 2nd. We do intend, and we're having conversations with our legal folks to make sure there will still be some mitigation measures in place for our long-term care facilities specifically, that we will still be looking for ways to protect that most vulnerable of populations, or what has essentially been ground zero for COVID. And whether we do that through amending the current order or we put on a new order for the long-term care facilities, we'll make that decision next week. With regard to the state of emergency, I have not talked to the governor specifically about what our plan is with that, and so I'm probably not in a position to give a good answer to that, but thank you, Jim.
Your next question is from David Skolnick.
Yes, hi. I don't see on the website cases per 100,000 for each county. Has that been eliminated from the website? And if not, where is it on there?
That is a great question. And I don't know, did Jeff just fall off? Jeff Brown, because he's our data extraordinaire person. The cases per 100,000 incidents shows up in our key measures. That they're key measurements, and it's in the, although that's a statewide.
Yeah, it doesn't say per count. I'm looking for each county.
Right. I apologize. I may have to, David, we may have to get back to you and find that. It is, we will certainly, I know that it is the governor's desire to have the per county cases per capita continue to be available. So if that's not currently, we'll get back to you on that. We'll make that correction.
Okay, thank you.
Okay. Your next question, which is the final question, is from Dan DeRose.
Hi, Dan.
Yeah, you know what? I think that's exactly what I was looking for. I was clicking on key measures and it takes us to the PDF
Okay.
where we normally find the cases per 100, and we're still looking at last week's numbers. So if those are going to be somewhere new, can we get a heads up of where to find those?
Yes, I will. We will get that corrected and I will ask Alicia to get that back out to everyone.
Thank you.
Yeah, no, thank you. And thank you for joining us today. I know there's lots going on, so thanks so much. I appreciate your time.